How eMedica helps in treating PCOS, obesity, and eating disorders. Background: PCOS and metabolic dysfunction. Polycystic ovarian syndrome, PCOS, is a complex endocrine disorder characterized by hormonal imbalance, excess androgens, testosterone, low progesterone, ovarian dysfunction, multiple immature cysts, irregular ovulation, insulin resistance, impaired glucose metabolism leading to obesity, and higher risk of type 2 diabetes. Psychological factors: eating disorders, binge eating, emotional eating, often linked to metabolic and hormonal dysregulation. Insulin resistance is the core driver of PCOS progression. It increases fat deposition, worsens androgen dominance, and perpetuates menstrual irregularities. eMedica's mechanism of action for PCOS: microcurrent and voltage infusion for insulin sensitivity. Microcurrent restores cellular voltage in muscle, fat, and ovarian tissues. Enhances glucose uptake by improving the function of insulin receptors. GLUT4 translocation. Increases ATP by up to 500%, providing energy to normalize ovarian cell metabolism. Reduction in oxidative stress and mitochondrial dysfunction improves insulin signaling pathways. PI3K ACT. Result: gradual reduction in insulin resistance and improved ovarian function. Specific frequency programs for PCOS and thyroid gland. PCOS program balances hypothalamic pituitary ovarian (HPO) axis, improves follicular maturation by restoring rhythmic gonadotropin release (FSHLH) balance, reduces androgen excess, decreasing symptoms like acne, hair fall, and irregular cycles. Thyroid program for metabolic stability optimizes thyroid gland signaling, which is often sluggish in PCOS patients. Enhances metabolic rate, reducing fatigue and weight gain. Combined use helps normalize menstrual cycles and reduce cyst formation. Obesity and eating disorder program. Fat cell breakdown. Microcurrent targets adipocytes, fat cells, reducing fat accumulation around the liver, ovaries, and abdomen. Improves lipolysis and reduces visceral fat, which is linked to PCOS severity. Appetite regulation. Frequencies targeting the hypothalamus, appetite center, balance hunger and satiety hormones, ghrelin and leptin. Reduces binge eating and stabilizes emotional food cravings. Mood and stress balance. Microcurrent modulates neurotransmitters, serotonin, dopamine, GABA. This reduces anxiety, depression, and emotional eating seen in PCOS patients. Systemic benefits of eMedica in PCOS. Reduces insulin resistance, lowers fasting glucose and insulin levels. Improves ovarian function, promotes ovulation, fertility, and menstrual regularity. Reduces androgen symptoms, less acne, hair fall, and hirsutism. Supports weight loss, decreases central obesity and visceral fat. Improves thyroid and adrenal balance, stabilizes metabolism. Enhances mental well-being, reduces stress, anxiety, and eating disorder patterns. Clinical safety and lifestyle support. For best results, patients using eMedica should also follow a low glycemic index diet, reduce refined carbs, sugar, avoid junk food, alcohol, and smoking, engage in light exercise, walking, yoga, or stretching. Use doctor-prescribed supplements or medication, e.g., metformin, if needed, under supervision. eMedica improves drug absorption, often allowing dosage tapering over time. eMedica treats PCOS by targeting the root cause, insulin resistance and hormonal imbalance. Through its PCOS, thyroid, and obesity programs, EVASH restores insulin sensitivity with microcurrent, normalizes ovarian and thyroid hormone regulation, reduces visceral fat and controls appetite, improves mental well-being, reducing emotional eating, The result is improved fertility, reduced PCOS symptoms, weight loss, and better metabolic health. A holistic, non-invasive approach to long-term PCOS management.